I want people to like me. I consider myself a kind person, I enjoy helping others, empathizing, and I don't like confrontation. This is part of my personal identity. It is what makes me me and a big part of why I went into nursing. Although I do associate myself with these characteristics, I have learned that sometimes in nursing, we have to challenge this personal identity in order to provide the best care for our patients, and that sometimes this means confrontation. On my first day of site clinical this year, it was nearing the end of the day. I was feeling good about my day and proud of myself for going through the safety questions with patients. I approached two patients sitting in a common area. As we began our discussion, it was brought up that one of the patients was a nurse. The patient discussed with me her clinical rotations, how she was feeling, and that she was looking forward to being discharged. These topics were fine to discuss, as it may be therapeutic for patients to talk about a job that they feel passionate about or their discharge plans. However, as the conversation progressed, I began to get that feeling in the pit of my stomach that something just wasn't right. The patient began asking me personal questions. It started out with basic questions like my year in nursing school and what we were doing for our clinical rotations. I should have recognized here that I should trust this feeling in the pit of my stomach and redirect the conversation. However, I didn't. The patient then asked me what the UMass party scene was like, to which I responded that due to COVID, the campus is quiet. It was then that this conversation ended, as my faculty had been listening and recognized the lack of therapeutic communication and helped me to exit the conversation. I felt embarrassed. I did not know how to handle this type of situation and knew that I did not maintain that therapeutic boundary that is so essential to psychiatric nursing. In reflection, I think I allowed this fear of confrontation in my personal life to carry over to my clinical experience, which did not benefit my patient nor myself. Although this experience was difficult for me as a student, I am grateful for it because it showed me an area of myself that I can improve in as a nursing student. The following week, at the group therapy that we attend, one of the members was discussing a topic that didn't really align with the group discussion, and one of the staff provided simple redirection stating that although that is a good idea to bring up, we really want to focus on the topic for the day. Witnessing this provided me an example of how therapeutic communication can be maintained. What I thought would come off as confrontational and rude is actually anything but. By encouraging the therapeutic boundary, we help our patients, and we can often do so in a way that is still kind. If I could have done this interaction over again, and in all my interactions with patients since this situation, as soon as I began to see the conversation drifting, I returned with responding that I am a nursing student at UMass and that I'm really here to speak with them and hear how they're doing. I have yet to have a conversation stray after this statement, but feel confident that if a conversation did stray, that I would either feel more confident in being direct and assertive, or that I would recognize the boundary crossing and exit the conversation appropriately if I felt I was not equipped to therapeutically interact with the patient. I wanted to better understand how this type of interaction impacts other nursing students and found a journal article that sought to clarify the concept of therapeutic communication through a systematic analysis. Researchers identified that therapeutic communication as an important means of building interpersonal relationships was paramount among nursing students' perception of the technique. Researchers noted that although social interaction exists in therapeutic communication, there is a difference between the two, as the nurse or nursing student and the patient are not balanced in their roles. Nursing students and nurses take the responsibility for the communication and must accept and respect the patients based on professional standards to care for all patients. It was this statement that truly stood out to me. In my interaction, I did not take responsibility for the conversation. Despite that feeling in the pit of my stomach, I allowed the conversation to continue straying to a non-therapeutic state. In reflecting on my learning, I have now learned to trust this feeling and to redirect the conversation as soon as this arises. Through this experience, I am better equipped to engage in therapeutic communication, which is beneficial to both myself and my future patients.